Medical debt is different from other types of debt, including auto loans, mortgages, and student debt. First, home, car, and student loans could be perceived as functionally necessary, but the level of debt incurred has a direct relationship with an individual's spending power. However, in the case of medical debt, unexpected illnesses, accidents, and ongoing treatment interventions, patients are unable to effectively budget for medical expenses appropriately. Second, the circumstances surrounding the pursuit of healthcare services, especially in the case of accidents and emergency illnesses, make it difficult for patients to shop for affordable care services. Besides, there's little price transparency from healthcare providers, and as such, even if the patient has time to shop for affordable services as in the case of long-term treatment, there's limited price-related information. The cost of care is determined by a number of factors, including insurance coverage, the intensity of care, regulations or laws, and location. Inflationary pressures on the cost of care have pushed providers further into concealing the actual cost of care, with patients unprepared of such costs ending up accruing massive medical debt. Laws such as the No Surprises Act are pushing for transparency in how healthcare services are priced, since patients with terminal illnesses cannot just opt out of treatment without some serious consequences. Third, patients who are unable to settle their medical debt are forced to forego future healthcare needs since they cannot afford treatment and they're perceived as a liability by other healthcare stakeholders. 1 in 7 patients are turned away by healthcare providers due to outstanding medical debt. Some studies report a relationship between medical debt and difficulties in taking care of oneself as a senior citizen. Patients who cannot afford care often postpone treatment, thereby worsening their health outcomes. Fourth, unlike all other forms of debt, patients are never screened for their creditworthiness prior to receiving care, a phenomenon which implies that credit histories do not determine the size of medical debt a patient can accrue. When care services exceed what a patient is able to afford, they immediately go into debt. Creditworthiness, while it might be perceived as a limiting factor to borrowers, protects consumers from debt they cannot pay. The lack of creditworthiness in treatment, or it having minimal effect on the kind of care an individual can receive, means that patients are not protected from the amount of debt they can accrue in the process of seeking treatment. The effects of failing to account for creditworthiness in treatment interventions, and the relevant outcomes of that, are worsened by the do no harm principle of healthcare interventions that seeks to ensure that patients receive the best care possible as an approach to enhancing health or preserving life. The difference between medical and other forms of debt makes the resultant consequences quite unique. One of the most extreme consequences of medical debt, or any debt in this case, is pushing payers into poverty. In the case of America, an estimated 8 million people are pushed into poverty due to out-of-pocket medical expenses that are not reimbursed by their respective insurances. Unpaid medical bills end up in collections where the original creditor sends the debt to a third-party agency to follow up. Medical debt is the most common debt that goes into collections, as well as the most common contributor to bankruptcy. Particularly, 60% of personal bankruptcies are related to medical debt, especially due to income loss and paying medical bills. About 75% of bankruptcy filers in 2007 had health insurance, with over 90% having medical costs exceeding $5,000. As of 2019, 59% of bankruptcy filers attributed their bankruptcy to medical debt. The median amount of medical debt for those who list it in their bankruptcy filings is $2,326, but 15% of the filers had debt exceeding $10,000, and 3% have medical debts exceeding their annual income. Bankruptcy filers with medical debt not only owe healthcare providers, but also issuers of healthcare-specific credit cards. Some of the most common strategies used to settle medical expenses include using long-term payment plans, incurring credit card debt, taking out extra home mortgages, borrowing money from payer lenders or family members, and withdrawing money from long-term savings. Other people are forced to scale down on basic necessities such as food and housing to be able to repay medical debt. Having medical debt is associated with reduced self-reported financial well-being, with 25.8% of those with medical debt reporting reduced financial well-being compared to 7% of those who do not have medical debt. 58% of debt in third-party collections is medical-related, and it often shows up in holders' credit reports, with approximately 1 in 5 credit records in the national panel having at least a single medical debt in collections. Between 2014 and 2020, the balance of medical debt in collections was more than all other forms of non-medical debt combined. Despite these statistics, medical debt makes up 11% of all the revenue in the debt collections industry. The fact that medical debt is both complex and unique in nature has been used to explain why some credit models rarely account for defaulting on medical debt as part of an individual's credit score, since even those with medical debt pay up their other financial obligations on time. Similarly, rarely do paid medical collections reflect an individual's future in terms of creditworthiness. Some studies suggest that individuals with only medical collections often see their scores improve by up to 25 points, which is not a good indicator of financial resilience that is largely measured by access to credit. Lower credit scores reduce access to affordable credit cards, insurance rates, auto loans, and mortgages. It is, however, important to be fully aware of the compounding effect that medical debt could have on future employment, housing, and access to credit, as well as the financial exclusion of uninsured, low-income individuals, and communities of color.